Multiple myeloma is a malignancy of the plasma cells and is really part of a family of a spectrum of disorders that we often call monoclonal gammopathies. The most common of these would be monoclonal gammopathy of undetermined significance, smoldering multiple myeloma, and multiple myeloma itself, or sometimes called active multiple myeloma. This spectrum is really important because MGUS, or monoclonal gammopathy of undetermined significance, is incredibly common. In fact, over 5% of all individuals over the age of 40 have an MGUS if we look for it. But a much smaller fraction of patients develop smoldering multiple myeloma, and an even smaller fraction develop active multiple myeloma. Active myeloma, or myeloma, accounts for approximately 1 to 2% of all malignancies, which means here in the United States we see approximately 35,000 new cases per year, and approximately 200,000 individuals are living with multiple myeloma right now in the United States. That spectrum becomes really important to understand the differences between them, because the major difference between smoldering myeloma and active myeloma is where we tend to treat patients and where patients have the classic manifestations of multiple myeloma. It's important to note that myeloma has changed in its definition over the last decade. We used to define myeloma by the presence of 10% or more clonal plasma cells in the bone marrow, plus at least one of the so-called CRAB criteria, C-R-A-B, calcium elevation, renal insufficiency, anemia, or bone disease that could be attributable to those plasma cells. That definition has now changed as we've recognized that we want to catch this disease earlier in its disease course. 3 more features have been added to the CRAB criteria, now known as myeloma-defining events. Often we call these SLIM CRAB to remember them. The S stands for 60% plasma cells or more in the bone marrow. The LI stands for light chains, where the serum-free light chains are elevated, such that the involved over the uninvolved levels, either kappa over lambda or lambda over kappa, are greater than 100. And the M stands for MRI, where we see greater than 1 focal lesion in the bone marrow itself. So if a patient has 10% plasma cells that are clonal in the bone marrow and any of those 7 myeloma-defining events, then the patient has active multiple myeloma. Multiple myeloma is more common in certain populations. We see myeloma twice as common in the African American population. Multiple myeloma is more common in men than in women. And there are other factors that are associated with the incidence of myeloma, which include obesity, the presence of certain exposures that include Agent Orange and certain toxins, and indeed, if a patient has a previous or known history of monoclonal gammopathy of undetermined significance, or MGUS, that puts them at greater risk of developing multiple myeloma.